In this video, I'm going to talk about hand, foot, and mouth disease. It is an acute viral illness that presents as a vesicular eruption in the mouth, hands, feet, and sometimes in the buttock and genitalia. It is a self-limiting disease with mild systemic involvement, and there is usually clinical improvement after 3 to 5 days. The cutaneous and mucosal lesions usually resolve in 7 to 10 days, and this hand, foot, and mouth disease is commonly seen in children less than 5 years old. For pathogenesis, it is transmitted through fecal-oral route and can also be spread via close contact, air droplets, or fecal contact. So, contact with skin lesions or oral secretions, and then the virus can replicate in the oropharynx and also pass into the bowel to replicate in the lymphatic tissue, excreted in the pharynx and feces for weeks. For clinical features, we divide it into 2 phases, which are the prodromal phase and the exanthematous phase. So for prodromal phase, before that, the incubation period for hand, foot, and mouth disease is usually 1 week. And during the prodromal phase, the children might experience some fever, anorexia and malaise, irritability and headache, sore throat, and also poor feeding. Whereas for exanthematous phase, they might be experiencing painful vesicular rash at the hands, feet, the buccal mucosa, hard palate, tongue, and sometimes the buttock and genital area. So these initial macular lesions rapidly progress to erosive vesicles surrounded by erythematous halo or base. So these pictures over here shows the vesicular rash on the hands, foot, and mouth. For investigations, hand, foot, and mouth disease is usually clinically diagnosed because it is very obvious, and we can also investigate by doing viral culture and also polymerase chain reaction. For treatment, it is mainly supportive treatment. There is no specific antiviral or preventive vaccination that can be given. We just ensure that the child has adequate fluid intake. We can give direct analgesia, for example, spray or mouthwash. We can also give antipyretic for the fever or analgesic for the pain. And the analgesic that we can give are acetaminophen and ibuprofen, whereas we avoid using aspirin in children. And besides that, we can also give antihistamine. So that's all. Thank you.